watching her. I'm going to hold her. Okay, this little video is about the essential points. I have chalked them on, and just because the skin moves, they might not necessarily be in exactly the right place. But what I'll do as I light them, I'll also just explain how to find them. I'm holding her because she bites. So, again, remember, we're just going to show her the torch, and eating that's fine. Okay, our first one that we're going to do, now it doesn't matter what order that you do them in, I'm just going to start from the top of the head. Just a little story was, normally I kind of start in the shoulder here, and the horse that I was working on just went like Burko, but it turns out that he has a needle phobia, and me reminded him of he's going to get a needle. So I actually started with him up the other end, and then by the time I came back, he was like, yeah, that's okay. So they're just little tips in case things aren't working out. Maybe just try something else. Okay, so our first one up the top is governing vessel 20. So remember that governing vessel is actually on that midline at the top. So even though I've got the blue dot there, it's actually, she's got her pole just here, and then it's just, you fall into the lump, behind the lump into the little divot about there. But it was just a little bit hard to put the blue there. So notice again, because there's been a little bit of talk about this, because it's in her mane, I've kind of parted the hair so that the light actually goes onto the skin. Otherwise you're going to end up with the light refracting out and only a little bit getting to her. So actually she's gone into hello mode. See her eye? That's what I mean about the eye. I wonder whether she'll do my little running carotid artery. Okay, so the next one, so around 10 seconds, depending on what torch you're using. If you're not sure and you don't have an R light, just message us and we'll work it out. Sometimes I just like to stay on there for longer, and sometimes I don't. So this one is bladder 10. Now, again, so this is her thing with the eye. That's really interesting. So I'm going to take that off, but I'm just going to show you why we're here. Usually at the end of the ear, you'll find it. And also, she's got interesting head obliques actually. So you run your fingers down, and you'll fall into a little hole just here. So see, I'm a circle's a bit wrong, into there. So that's 10, bladder 10. Now the next one that I'm going to do, and because she's a little bit bitey, I'm being a little bit nicer to her, because I think when I first went in to draw my dots, I was a little bit too like, I'm drawing the dots instead of actually introducing myself to her a little bit better. So 11, my dot that I've drawn up here is actually a bit high. So if you've got your scapula comes around, sometimes it's really hard to feel because of a bit more tissue, but just imagine that you've got your scapula and where the cartilage starts. So sometimes another good indicator is your spinous scapula. It'll end where the cartilage starts, and then you can come across, because it's actually in a little divot as it comes into the cartilage, into the bone. So that's way.
She probably had her head up.
She probably did have her head up at the time. So we're going to go in there, but again, if you're really unsure and you go, oh, I'm not sure whether it's there or there or there, just light all the points. It's okay. And just have a little assess of what other points, because remember, there's not just a bladder meridian here. There's triple heater, large intestine, gallbladder. So she just had a little lick and chew. So our next one to find is gallbladder 21. Now that one sits, so cervical spine, and where it intersects with the shoulder coming in behind. So sometimes you have to have a feel. That's another one that I always found it rather difficult. I read books all the time to try and work out where it is. And what probably confused me the most is their neck set. So in a book, you might look like that large intestine's a lot further away, large intestine 16 and bladder 11, but just have a look at their neck anatomy instead. And just remember, top of cervical spine intersecting just before your scapula. And then large intestine 16, that one, brachiocephalicus muscle, you can feel it. And then it's just the dip, again, where that crosses over and you have your scapula just here. So it's more like there. Good girl. So she had the little lip wobble at first and then a bit of a sigh. So you come across the top of the scapula. If you're trying to fly in bladder 13, this was another one where I was like, oh, where are you? Come around and you fall into a bit of a dip as well. And again, don't stress if you think it's wrong. It's okay, light there. It's okay. That's the beauty of, they talk about acupuncture and it's the size of the needle, and that's really cool that torches are so much more rounder. And again, the points are transposed from humans and compared to where it is with the anatomy on the horses. If you get a response from somewhere close by, that's cool. Okay. And then with bladder 23, you have your last rib that comes around here, and you have your top of your tubercoxy, and it's a triangle, so between there, and falls into a dip. She was moving around a little bit at the time. So this one again, another way that you can find it is go like, so feel the edge, and go up like that. That's another way, or literally draw the triangle. So again, if you've got a horse that's got a long lumbar, it's going to look like it's in a different place to a horse that's got a shorter lumbar area. Next one is Baihui. That is in the lumbosacral joint. Sometimes horses that have got a lot of extra padding around the top area here can be a little bit harder to find. But again, so it's on the governing vessel line. Run your fingers along and you can fall into the dip before it meets the tuber sacrale, or come that way, fall into a dip. Again, some are really easy to find and others are not so easy. Often in line with your tubercoxy as well. We did this one on her earlier, so she's just having a little rest. Often, when I'm doing bladder 23, I often add in 20 and 21 as well, because in the horse world, I think that a lot have digestive issues. So I just pop that one in there as well. And so that one is at the end of the last rib, so you follow that up in. And then the next one over into your next intercostal space and follow it up. So about there and there. So I'd go for in 23 and do those two as well. And often that's when you might get a lot of tummy rumbling too. So this next one here is on the hip joint. So you find your hip circle, which is usually in line with your ischiatic tuberosity. And so it would be on the edge of the greater trochanter. And just, oh, nice one. Bit of a stretch. She is actually the best out of all of them, isn't she, Jess? If this was Venus at home, she'd just be farting constantly. Lots of fun. Actually, she's a yawner as well. Big yawns. Yes. Okay. So, just as a little add in there, when I finish this, I'm actually going to go over to there and just do that point for her as well. All right, the next one that I'm going to do is, I'm going to go for bladder 40 simply because she has her leg in that great position that she can show us that it's just in the divot point there. So if you've got the leg straight and you're finding it hard to find, just lift their leg up. Whoops. See how, so good. So much easier to see when she has that leg flexed. Pretty sure this is the aspirin point. This is the Panadol. And then the next one that we're going to do is bladder 60. So that one is, so you have your calcaneus come in and your hock here. And then just as it meets at that point in there, sometimes there might be some fluid around there. This is the part, Jess, where we'll have to make some videos on how I go exploring in other places. So when you're actually reading, so this one's Gallbladder 34, another one that used to really get me where I didn't think I could find it. So you find your
tibial crest.
Yeah, I had a mind blank. That's like my favourite word. Tibial crest, and then I come across and there's a dip in there. So what might make you think, oh God, I don't know where it is, or it doesn't look like, had another sigh, doesn't look like what it looks like on that horse there, is often because they have a longer tibia, that their anatomy is different. So go back to where is it on the anatomy, and that often helps. And then so with the next one is stomach 36, the way that I got taught, and my fingers are pretty much close to what a sun is for most horses, is pop it tibial crest again, and then about 4 finger width, and then in lateral. Sometimes you can just feel, I can actually feel hers. There's you just go, this is my really weird words that you just go, padum, into the hole. My technical words get a little bit crazy. And that one's stomach 36 is one of those points that often is like Baihui, where it does lots of things and lots of people like to use that one. You'll find it in different places that put out the wellness, essential points. They all call them something different. You'll find that a lot of these are in everyone's.